This presentation will cover ensuring a safe home environment for your loved one with dementia. The objectives of this presentation are: discuss signs that your loved one may not be able to live alone at home any longer, review potential safety concerns for your loved one at home, go over ways to ensure home is a safe environment, discuss emergency resources that are available. When is it no longer safe to live alone? Often, when we begin to question whether someone should continue to live alone at home, there are already some concerns about a person's safety at home. Here are some things to consider when making a judgment about whether someone can continue to live alone. If the answer is no to any of these questions, it is a sign that the person should not continue to live alone without assistance. Can they clean, bathe, and dress themselves? Can they prepare meals? Do they remember to eat? Can they keep their home reasonably clean and free of hazards? Can they still balance money to pay for important bills like heat, water, and electricity? Can they arrange their medications? Are they having a lot of falls? Would they be able to call 911 if there was an emergency? Are they wandering out of the home and getting lost? Are they making poor decisions like allowing strangers to live in the home or giving away money to strangers? Ensuring safety at home. As dementia progresses, judgment becomes more impaired, and your loved one may not be able to perform tasks they once were able to do as well. So, it is important to ensure that home is a safe and secure place. Some of the potential hazards include falls, fire setting, choking, wandering out of the home, firearms, medication overdoses. In the following slides, we will discuss tips to decrease these hazards at home. Falls. Due to weakness and poor coordination, patients with dementia are at an increased risk for falling. Falls can cause further head injury that can worsen dementia or broken bones that can limit mobility. Here are some tips to prevent falls. 1. Try to ensure that your loved one's room and a bathroom are downstairs to limit need to climb stairs. Consider blocking stairways with gates. 2. Keep floors and hallways to essential parts of the home free of clutter. Consider removing decorative rugs as this can cause trips and falls. 3. If you are noticing increased weakness, request for a physical therapy evaluation to see if your loved one needs a cane or walker to get around. 4. Limit sedating medications in the daytime. Speak with your provider as they can help advise on this. 5. Ensure the pathway to the bedroom and bathroom have some light so they are more easily visible at night. You may need to consider a commode at bedside to limit nighttime trips to the bathroom. 6. Use non-slip stickers in the bathtub and a non-slip bath mat to prevent falls during bath time. A shower chair can also be used. Fire setting. Due to forgetfulness or confusion, your loved one may accidentally leave stoves, ovens, or electrical appliances on, increasing risk for fire. To prevent accidental fires at home, remember to 1. Unplug the stove or oven, or remove knobs from the stove or oven. There are also safety covers you can purchase to put on an oven or stove. You can find those on the next slide. 2. Prevent access to lighters or matches. 3. Ensure smoke detectors work and have batteries. 4. Put away electrical gadgets like hair dryers or toasters that, if used improperly, could cause a fire. This is an example of an oven safety knob mentioned in the previous slide. Choking. Dysphagia, difficulty swallowing, can be a problem that arises with dementia. Some individuals may begin to forget to swallow and may need prompting to remember to swallow. If you notice your loved one is coughing during meals or need prompting to swallow, speak with their physician about having a swallowing study done, as this can help determine which foods are difficult for your loved one to swallow. Try to make sure your loved one is sitting upright while eating. Cut food into bite-sized pieces. Mashed solid foods like mashed potatoes may also be easier to swallow. Consider thickening liquids, as this may also be easier to swallow. Ask your doctor which pills can be crushed and put in a semi-solid food like pudding to help with swallowing medications. Some medication also come as solutions or dissolvable tablets. Wandering. Due to confusion and forgetfulness, your loved one may forget where they are and try to leave to go home, even though they are at home, or think they have to go to work or an appointment when they don't have to. They may then become lost even if they have just wandered not too far out of their own neighborhood. Wandering can also be an expression of boredom or anxiety. Brain damage from dementia may also cause some individuals to pace and try to exit seat constantly in the day. Here are some things to consider to try to prevent wandering. 1. If your loved one is constantly trying to exit out of the home, consider covering the doorway with a decorative rug so they do not recognize it, and place items like keys or purses away from the door so they are not reminders to try to leave the home. 2. Purchase a medical bracelet with your loved one's name, address, or your phone number, and a notifying message that the wearer of this bracelet is memory impaired. 3. Door alarms may help alert you if your loved one is trying to leave the home. There are now models with cameras as well that will allow you to see what is happening if the door alarm is triggered. 4. Ensure windows are locked. Someone who is confused and frightened may try to exit out of a window if they cannot find the door. 5. Cell phones have tracking on them nowadays, so consider using cell phone tracking if your loved one wanders out of the home. 6. Wandering is likely to become worse if your loved one is in an unfamiliar place. Keep as many cherished and familiar items in the new environment. Gently reassure the person that they are safe and cared for. 7. Consider scheduling time for exercise in the day. Going on a long walk with your loved one may reduce the tendency to wander. Below is a video on wandering from the University of California, Los Angeles. Please click on the link. Firearms. When your loved one is unable to live alone, see the first slide, it is also a good idea to remove firearms from the home. If someone is not able to perform the functions listed earlier alone at home, they do not have the proper judgment to use a firearm safely. Removing a firearm can be distressing to your loved one as it may make them feel less safe at home, or the firearm may be of sentimental value. Here are some tips for removing a firearm from the home. 1. Talk with your loved one about passing on the firearm to a close family member. This may make them feel more comfortable about letting go of a cherished firearm. Please ensure if the firearm is passed on that the individual is legally allowed to receive a firearm per West Virginia state law. See the next slide for that. 2. Consider keeping the firearm in a gun safety cabinet that they do not know the combination for. 3. Never keep bullets in the home where they are accessible. Disarm any weapon in the home. 4. Contact your local police station about the process for surrendering a weapon to law enforcement. Firearm Disposal. Below is the link which refers to the appropriate sale and disposition of firearms in the state of West Virginia. Please refer to page 32. Medication overdose. Many older adults are on multiple medications for different medical problems. It can become very difficult for someone with memory problems to keep track of and organize their medications. This can lead to accidental overdoses of medications or missed doses. Here are some things to consider about medication safety at home. 1. Consider organizing medications in a pill box with days of the week labeled on it. Your pharmacy may also make pill packs that pre-separate medications by day of the week. Mail order pharmacies do this as well. 2. Discard unused or old medications immediately and make sure pill bottles are not accessible in the home. 3. If you suspect an overdose, you can contact the prescribing physician or poison control at 1-800-222-1222. The link below is a comprehensive home safety checklist from the Alzheimer's Association. Please click on the link. In summary, determining whether your loved one can continue to live alone is essential to maintaining safety in the home. Some of the safety concerns that should be thought of are falls, fire setting, choking, wandering out of the home, access to firearms, and medication overdoses. The Alzheimer's Association does have helpful checklists to ensure your loved one's home is safe. This concludes the presentation of Safety in the Home.